Coming up on KPBS Evening Edition, we go behind the politics of the federal health care law and find out how it's changed health care in San Diego.
And the new report shows how San Diegans spend their money. Looks like America's finest city is also one of the most expensive. KPBS Evening Edition starts now.
Hello, thanks for joining us. I'm Joanne Ferrian.
I'm Dwayne Brown.
Police in El Cajon say they have not ruled out the possibility that the recent beating death of Shaima Alawati, an Iraqi immigrant, could have been a hate crime. Adrian Florido joins us from the KPBS News Center with the latest developments in the case. Adrian, remind us of the details of this case and why there's speculation this could have actually been a hate crime.
Well, Alawati was a mother of 5. On Wednesday, her 17-year-old daughter discovered her in the dining room of their home in El Cajon, very badly beaten. Nearby, police found a note which, according to the daughter, called her mother a terrorist and suggested that she return to her home country. That's the reason there's been some speculation that this could be a hate-motivated crime.
Now, the El Cajon police chief held a press conference today. Did he offer any new details?
Not anything that hasn't sort of already come out. He did say that that the police department is continuing the investigation, that they have not ruled out the possibility that this is a hate crime, but he also did not confirm the details that the daughter offered to local media a couple of days ago about that note. So he didn't say that that was in fact the content of the note. It confirmed that there had been a threatening note, but didn't actually say what it said.
What's the next step in this investigation?
Well, the police department says solving this crime is a top priority for them, that they believe it's an isolated incident, and that the investigation is still in very initial stages, that they haven't ruled out, again, the possibility that it could be a hate crime, but that there's other evidence that they're also going to be following up on, and that they will let the public know as soon as they have made further conclusions.
KPBS reporter Adrian Florido.
A military appeals court has upheld a murder conviction for a former Camp Pendleton Marine. He was convicted of leading his squad in the killing of an unarmed Iraqi civilian. Larry Hutchins is the only member of the Pendleton 8 behind bars for the 2006 killing in Hamdaniya. The Navy has rejected his request for an early release, saying he needs to be sufficiently punished to deter others. Hutchins is being held at the Miramar Air Station. His attorney says his appeals will continue. A bizarre twist today in the case of a former Tea Party spokesman accused of rape. The alleged victim says police have the wrong man. Michael Kobelnicki is accused of raping the woman on Fiesta Island, but during a bail hearing this morning, the woman said he was not her attacker. Kobelnicki's lawyer says he's admitted having sex with the woman, but says it was consensual. His bail was cut in half after the woman's statement today, but he still faces 4 felony counts.
There were more arraignments today in a so-called pay-to-play case in the South Bay. A former Southwestern College administrator pleaded not guilty to charges of perjury and filing false documents. The district attorney's office says officials at the college and at the Sweetwater Union High School District took gifts in exchange for their votes on construction contracts. An architect and a construction company executive have both pleaded guilty in the case and are cooperating with prosecutors.
Republican Mitt Romney's presidential campaign rode through San Diego today. Romney is, of course, no stranger to San Diego. He has a home in La Jolla. Today, he was trying to pump up supporters and raise money for his campaign. KPBS business reporter Eric Anderson has been following the story and joins us from the News Center. So what did Romney focus on today, Eric?
Well, the big issue was health care reform. Near the top of his agenda these days, he dropped by a San Diego startup company, NuVasive. That firm pioneers new techniques and devices for spinal surgery, and he used the platform to attack the federal government's health care reform efforts.
There are a lot of reasons not to like Obamacare. My colleagues the other day listed a whole series of them. There were about 30 things, and I chuckled as I looked down, just shaking my head at the things Obamacare is doing.
Romney said the reform effort was going to be twice as expensive as promised and would also push up the cost of health insurance and reduce patient choice as employers drop their health care plans. He also took the Obama administration to task for its handling of the economy. He said several times that the president just doesn't understand how the economy works.
And why would he come to San Diego now?
Well, it's important for him to rally his base. In fact, he joked that it was still quite a while before the California primary in June. And then he went on to say that California voters are important, but he was also in town to raise money. He went to a fundraiser at the U.S. Grand Hotel after the stump speech. About 20 people turned out to protest the appearance. And after that fundraiser, he's heading up to Redwood City for a fundraiser. And then tomorrow, 2 more, one in Stockton and one in Irvine.
KPBS business reporter Eric Anderson. U.S. Supreme Court heard its first day of arguments in a case that could decide the fate of the Affordable Health Care Act. Joanne is talking about how the federal law affects people in San Diego over at the Evening Edition Roundtable.
Just what is at stake for San Diego if all or sections of the new federal health care law are struck down? Joining me are Kamal Mullenberg with San Diegans for Healthcare Coverage and Gregory Knoll, Executive Director of the Consumer Center for Health Education and Advocacy, an independent program of the Legal Aid Society of San Diego. Thank you both for being here.
Thank you.
Thank you.
Gregory, let's start with you. In a nutshell, what are the opponents arguing right now before the U.S. Supreme Court?
Today starts 3 days, total of 6 hours of arguments on 4 major topics. Is it too early to challenge health care law because the penalties don't go into effect until 2014? Is the individual mandate itself constitutional? And if it is not constitutional, can the rest of the law survive without it? And then lastly, 26 states have filed suit regarding the expansion of Medicaid that would, if they refuse to play ball on the expansion of Medicaid, they would lose all Medicaid dollars, and they say that that sanction is not within Congress's power.
Now, Kamal, we hear a lot of people who oppose this. I think the campaign against this healthcare law has been fairly vocal. Mm-hmm. Do we know, though, in terms of California, what the polls say with support?
Well, California is generally tracking along with the rest of the country for if you just ask them what they think about the ACA. But when you drill down into what the ACA is really about, you find that the support goes way, way high. And that's been consistent across the country, too. I think people don't understand this law. They've been listening to a lot of sound bites, and it's very political.
So let's talk about that. Let's drill down a little bit in terms of this law. Tell us so far what has been implemented in California, how that would affect people in San Diego right now.
You know, I wish I had the local numbers. I don't. But for instance, you can cover your child up to age 26 on your plan, and over 2.5 million children have been covered that way. So that expanded age limit was a huge benefit. We no longer can exclude children from coverage because of pre-existing conditions. So those kids who really need the care are able to get it now. And they cannot be refused by a health plan, whether it's in the individual market or the group market.
You have a personal experience, too, in terms of how this law has affected your family.
Yes, my daughter had a lot of medical concerns, and she was uninsured for 2.5 years after she aged out of my coverage plan. And then when they reinstated that children could be on, it wasn't reinstated, put in the new law that children could be on until the age of 26, I was able to put her on, which saved me thousands of dollars. I was taking care of her out of pocket, and it cost over $10,000 while she was uninsured, just for her one medical situation. Right. And now she's covered. She has her own insurance through a small business, and everything is very good.
And Gregory, in terms of expanding this beyond just the individual now, your work with the Legal Aid Society, do you find that hospitals, doctors, businesses know how to access what's available to them through this law as well?
I think that's one of the biggest problems with the Affordable Care Act is that there is not enough education being done around people about how to access all of the good things about it. It's getting better, and I think a lot of doctors are very supportive. There was a very nice pediatrician wrote a nice article in the paper the other day about what it means for kids, some of the things that Kamal was talking about. I mean, I think when you try to take that away from people now that they have, that's a very difficult thing to do. There's a lot of people that every day are having their lives and the lives of their children changed because of the Affordable Care Act.
I think some people at home might say, we don't hear a lot of those stories.
That's true.
Why is that?
I don't know. I mean, I think You know, maybe it's a question of spending money. Maybe it's a question of whoever yells the loudest gets heard. I really don't know. What I do know is that in my work, I have had a number of examples. I had a family whose little girl had a congenital heart defect. After a year, she could not get coverage, and they almost went broke trying to take care of everything this child needed. The tears in their eyes when they found out that they were going to be able to have her pre-existing condition outlawed and that they could go ahead and get coverage was just, you can't imagine how people are changed forever with something like that. Same thing with parents who are worried about their kids. I had a single mother of two who was 22 years old. Her mother was desperate to try to cover her. She was working, but her employer didn't provide coverage. Well, Mom provided coverage, and it worked out great.
Well, we're going to continue to follow the story. Gregory Knoll, Kamal Mullenberg, thank you so much for both being here. Follow KPBS for more on this issue on the air tonight, tomorrow, Wednesday night, beginning at 7 p.m. We will have extended coverage, and also you can go to the web at kpbs.org for more on this issue.
1 out of 4 San Diego voters are registered as nonpartisan, and in June, they won't see any presidential candidate on their primary ballot. The county registrar says the election rule has caused some confusion in the past. So she's launched a campaign telling nonpartisan voters what to do in a presidential primary. They can ask for a Democratic or an American Independent ballot. Those parties have open primaries. But to vote Republican, you have to be a registered Republican. The GOP is one of several parties with closed primaries.
If a party has a closed primary election, it means that only those voters who are registered to vote with that particular political party are allowed to vote in the presidential contest.
Each party decides whether to open or close its primary. The rule only affects the presidential race. All the other contests are open. You can check your registration online at sdvote.com. May 21st, by the way, is the deadline to register for the June primary. It's no secret San Diego is an expensive place to live. In a moment, we'll look at just how San Diegans are spending their dough. Some of it may surprise you. While the unemployment rate has been dropping, just having a job may not be enough. A look at San Diego's high rate of underemployment coming up. This is KPBS Evening Edition.
Tonight on KPBS at 8, a 19th century whale's tooth necklace and a 1966 Andy Warhol of Jackie Kennedy are just two items appraised on Antiques Roadshow from El Paso. Then at 9, a lesson in school-related antiques in an actual one-room schoolhouse as the roadshow moves to Bismarck, North Dakota. And at 10, celebrate the centennial of the oldest and smallest ballpark in America, inside Fenway Park. That's tonight on KPBS.
I'm Jeffrey Brown. On the next news hour, day one of Supreme Court arguments over the landmark health care reform law. That's Monday on the PBS NewsHour.
Today, I'm in Vermont dairy country to discover how our energy can come from the most unlikely of sources. Find out on the new PBS series, America Review.
KPBS Evening Edition is made possible by Joan and Erwin Jacobs and by
San Diego has regained about half of the 100,000 jobs lost during the financial collapse. The county's unemployment rate is just below 10%, but that doesn't capture the entire picture. KPBS business reporter Eric Anderson says a recent Gallup poll finds California has one of the highest underemployment rates in the country.
Certified steelworkers gather most mornings at this suburban San Diego Union Hall looking for work. Dispatcher Cesar Cabrera helps some of them find it.
All right, guys, I have shelf steel. Looking for 3 guys. to go to Camp Pendleton for tomorrow, 7 a.m. I need 2 connectors and 1 ground man.
Mark Jacobs got one of those jobs. He was just laid off from steady work on another local construction project. Jacobs would love to be working 40 hours a week.
It's hard. It's a struggle. I'm married. I have 3 children. My wife works, but she's a waitress. She doesn't make a lot of money. So we got to budget our money and got to every day, come up here to the hall, sign the list, let your face be seen and fight guys, not literally, but, figuratively, to get a job.
It's Camp Pendleton Central Utility Plant. No, it's not that one.
Yeah, it's separate from I talked to Dana about it. It's like separate from the hospital.
Iron Workers Local 229 has about 1,200 members. Nearly 100 are actively seeking work. Business manager Jose Naranjo says that can easily swell to several hundred. He says the recent financial collapse was not kind.
The last 2 years has been pretty devastating here. They've been working on average maybe 20 to 24 hours a week.
That's pretty far removed from the heady days of a downtown building boom.
This is Petco Park, and we did all the steel erection, all the trellises, all the trusses on the project.
Just a few years ago, the construction of Petco Park and dozens of downtown condos kept the steelworkers busy. Hints of other major civic projects offer promise during a steady recovery. And while the economy is beginning to turn the corner, it's not turning that corner for everyone. There are people who are working, but they're not working full-time like they want to. A recent Gallup poll found that California had an underemployment rate over 20%. That made it among the 5 states in the country with the highest underemployment rates.
Underemployed is much better than unemployed. And there are a lot of people that don't even have part-time jobs that would love to have that.
Phil Blair runs the Manpower temporary hiring agency in San Diego. He says not everyone wants to work full-time, but he says the financial collapse forced many people to take part-time jobs just to keep the money coming in. And he's not particularly encouraged by the sluggish recovery.
Usually, if you look in history and economies, the faster we go into a recession, the faster we come out. And this one we went into very fast, and we're coming out of very slow. We're seeing significant systemic change in the way that employment is being handled.
Companies made cuts to save cash during the downturn. They developed efficiencies, and many don't plan to hire those people back. It also doesn't help that some of the region's industries rely on a part-time workforce.
Here in San Diego, it's also probably a little bit of a problem, and it's more accentuated, primarily because we have such a large visitor industry here that employs a lot of people part-time. And so more so than other places across the U.S., that's simply the nature of the industry.
Sandeg chief economist Marnie Cox thinks people put too much focus on the jobless rate. Adding the unemployment and underemployment rates paints a more accurate picture.
The unemployment rate that we're having by itself, not the underemployment, but the unemployment rate by itself, is probably not a good reflection of what's going on in the economy today. I think it's much worse than that.
Cox says nearly a third of the region's workers either don't have a job or are working part-time when they want full-time work.
KPBS business reporter Eric Anderson. Sandag's chief economist says he expects the San Diego labor market to add jobs this year, but the growth will be slow. A new report breaks down how much of our income in San Diego goes towards housing, transportation, and food. Joanne has more on the report at the Evening Edition Roundtable.
San Diegans spend more of their household incomes on housing than any other U.S. metropolitan area. That's according to some new numbers from the U.S. Bureau of Labor Statistics. Joining me to explain what the numbers say about San Diego and the people who live in this county is Kelly Cunningham, economist with the National University System Institute for Policy Research. Thanks for being here, Kelly.
Thank you.
Now, we've seen a decline in housing costs, yet we're still spending more money on housing. Why is that?
Well, we actually have seen housing prices come down, but the cost of spending on housing is still up there. And part of that, there's a number of reasons. It's how much we pay each month or each year for housing, but it's divided between those buying a home and those renting a home. And we've actually seen the cost of buying a home has come down, but the cost of renting has dramatically increased, especially in the last 3 years, at some 30%, which stands to reason. You know, people that have lost their homes to foreclosure or whatever have had to go into the rental market, and that's created a lot more demand on rental prices.
We had some numbers up there on the screen just a moment ago. 29% is what we're spending of our total household income on housing. That's the highest in the nation.
Well, it's the highest among the major metropolitan areas, and 29% of our budget of spending, our cost of living, our consumer expenditures. And for nationally, that's only 20%. So, yeah, we spend a whole lot more on housing, and that's just one of the factors of living in San Diego. I think it's always sort of been that way, but it's still, even like you were saying, the recession hasn't improved that much at all.
The other shocking number that came out of this is our home ownership and how we compare to the rest of the country. How many people in San Diego actually own homes?
Well, and maybe we should label it more as a home indebtedness that are buying a home, unfortunately. But I mean, that's what the measure is. Those that are buying a home is 50%, and that compares to the nation is 66%. And historically, it's been that way, partly because of the military. The military is very transient, of course, and we have the largest military contingent here. So that's part of the reason, but actually our population has grown where it's not as dominated by the military. It's a factor of just how high it is to buy a home here in San Diego. It's difficult for many people. We're one of the less affordable. I could point out that we don't have the highest housing prices, but when you combine that with our income level, that percentage is for the reason that we're the highest have the highest expenditures on housing.
Now, these numbers actually looked at spending overall, not just on housing. So if we're spending so much money on housing, do we have money to buy anything else?
Well, we certainly have less. That comes out, I think, in a factor that because you spend so much on housing, you have to reduce expenditures on other items. And there are some things that we actually spend less for than national averages. And of course, the best example for us is utilities. We spend a lot less on utilities. It's about 15% less, but it's not because utility prices are low or the rates for utilities, but it's because we don't use it as much. And that's, I guess, one of the benefits, of course, of living in San Diego. We don't have to spend so much for heating and cooling in the summertime.
Another difference between us and the rest of the country, we spend more money eating out.
Yeah, we apparently like to eat out. I don't know if that's because we're kind of time constrained. We it's easier to go out to eat, or we just like to eat out. I would like to think it's because we have a lot of good restaurants. We're certainly a visitor destination, and people come here to eat out, and so the locals. This reflects consumers or local residents, and we like to eat out too, and apparently cater or be patrons of the restaurants that are here.
Now, the survey also looked at transportation costs, healthcare costs. Quickly, with transportation, more or less than the rest of the country?
We actually spend less overall on transportation in every category, which are the costs of buying and maintaining cars or vehicles or mass transit. But in one important category, we spend more on average, and that's gas prices. We spend a lot more on that because gas prices are so high, and we have to use it too. We have to drive to work and to do everything. So.
And we spend less on health care. We give less to charity. So we have about 30 seconds left. For people at home, what's the takeaway? If you had to describe a picture of a San Diego household based on these numbers, how would you describe it?
Well, there's a cost to live in paradise, and I think San Diego's a great place to live, but there is a cost that comes with it, and the biggest factor again is housing. But then you have to do other things less, and one of the things I think we get to enjoy the outdoors. So we are healthier. We don't have to spend as much on health care. At least that shows up in the statistics, and even spend less on entertainment. So there's pluses and minuses, but there's a cost to being able to live in a great place like San Diego.
And we've got all of these survey results on our website, kpbs.org. Fascinating stuff, actually. Kelly Cunningham, thank you so much for being here.
Sure. Glad to be here.
San Diego voters weigh in on pension reform. We'll have the latest poll in just a moment. This is KPBS Evening Edition.
Tuesday at 10 on KPBS.
Dr. Martin Ellingham is a new dad.
Still no name.
Albert. Terry. And he's taking to it with his usual grace.
Jiggle him up and down a bit.
He wants to leave Port Wynne. And Louisa wants to stay.
It's a little bit complicated. Recipe for disaster.
But with a baby, Doc has a new outlook on life.
No, I don't.
Martin Clunes stars as...
Could you take the baby, please?
That's not our baby.
Doc Martin.
Watch new episodes, part of a season premiere event, Thursday at 8 on KPBS.
Welcome back to the Public Square on KPBS Evening Edition. Tonight, a look at a couple of polls on issues we've been covering. First, a new poll suggests a majority of voters support the ballot initiative on pension reform. The poll was conducted by the Center for Education, Policy and Law and UT San Diego. 56% of those polled support the Comprehensive Pension Reform Initiative. 30% of voters say they'll vote against the initiative, while 14% remain undecided. The measure would eliminate guaranteed pensions for most new hires and replace them with 401ks. It would also freeze pensionable earnings for 5 years. The second poll comes from USC and the LA Times. It found 64% of those surveyed support Governor Jerry Brown's measure to temporarily raise income taxes on high-income earners and increase the sales tax to generate more revenue for public schools. Well, if you want to say something about this story, you can join the conversation by following us on Twitter, liking us on Facebook, and of course you can always send me an email, jfarian@kpbs.org. And now let's go back to the news desk where Dwayne has a recap of tonight's top stories.
El Cajon police say the killing of an Iraqi woman appears to be an isolated incident, but they're not ruling out the possibility of a hate crime. Shema Alawadi was beaten in her home last week and taken off life support on Saturday. Her daughter says a note was left at the scene. In part, it read, "Go back to your country, you terrorist." Another construction company employee has pleaded guilty in the pay-to-play scandal involving building contracts in the South Bay. One former school official with Southwestern College is accused of taking gifts for votes on contracts. Charges were also filed against 4 current and former officials with the Sweetwater Union High School District. And Republican presidential candidate Mitt Romney campaigned in San Diego today, taking shots at the Affordable Health Care Act. Today's appearance was part of a fundraising swing through California. You can watch and comment on any of the stories you saw tonight on our website, kpbs.org/evening edition. Thanks for joining us. Have a great night. We leave you with a look at the forecast.